We have been working with the medical community to try to integrate medical care and social care for the benefit of the patient's health. Anytime a patient moves from one setting to another, and most of these clients were being discharged from either a nursing home or from home health care and had recent hospitalizations, some of these people end up falling through the cracks and care ends up being fragmented. So our goal is to look at the whole picture, do a medication reconciliation, and pull together all the different factors, both medical and social, to ensure that the client will be home safely and will not end up back in the hospital.
If they've been in there for a 3, 5, 8-week rehab, and if they are alone, no spouse, no family, etc., no one maybe has paid their power bill, maybe we need to restock their food.
Things like transportation, can someone afford the copays on their medications? Is their home safe?
But if you get into the home and they don't have the resources set up or any longer, they can't survive independently at home.
We do a complete psychosocial assessment when we go out into the home. And so we have the medical information from whoever gives us the referral, but we're addressing the social things that actually will impede someone from actually being at their optimum health.
I help with the case management program, and so I go to see people in their homes to help them stay in their homes safely. So we do an assessment where we evaluate what is their needs.
If someone does not have the basics, food, shelter, and clothing, you can't begin to address their medical needs in a way that they'll be able to thrive or understand.
We are very knowledgeable about all the community resources that are out there that can close the gaps that these people have.
It's really heartwarming, actually being in person with them. They actually get to see a face, and so do we, so it's not just a patient or a number. It's somebody we actually get to have a relationship with and help them through their journey to stay healthy at home.
We've established over time that we're an expert in community-based care through these interventions. We see what the medical community can't see because they're not in the home.
We're addressing things that the medical community would have typically looked at as social problems.
We received an email from CSDA, and I think our entire 4 buildings heard me shout. We are so honored by this. We know that we won in the small district category, and small we are, but what we're doing is so mighty in the lives of the people we serve.